You're planning for a baby? That's exciting. Will the baby look like mom or the dad? It's all in the genes. Genes determine some of your physical attributes such as eye color, height, and so on. But genes also carry risks for some specific genetic diseases. Genes are passed on by you to your child. But did you know that each of us are carriers of at least one genetic disease? Most of us are unaware about the genetic diseases we carry, as most often we show no symptoms of a disorder and are usually healthy. As a couple, however healthy you may seem to be, if both of you are carriers of the same condition, you do run a risk of passing on the genetic condition to your child, and the child can end up being affected or even have the disease. Genetic diseases do cause serious health problems, and some could even be fatal. Some of the most common genetic disorders in India are thalassemia, cystic fibrosis, and muscular dystrophy. Each year in India alone, there are over 1 million babies born with genetic disorders. 1 in 100 babies are born with inherited diseases. Unfortunately, you cannot cure genetic diseases, but you can prevent them. That's why at MedGenome we believe you should start planning for your baby earlier, much earlier. Presenting the Claria Carrier Screening Test from MedGenome. Based on the highly advanced NGS technology, the Claria Carrier Screening Test is the most comprehensive screening test for genetic disorders and screens over 2,000 genes. The test accurately reports your partner's and your carrier risk of having a child with genetic disorders. Most times, the risks will be low, and you can be confident about the health of your future children. But if we do find that your risk is higher than expected, our expert genetic counselors will be at your service to guide you and help you understand your options. With just small blood samples from your partner and you, Claria screens for over 600 disease-causing mutations like thalassemia, Duchenne muscular dystrophy, cystic fibrosis, and many more. Some of the conditions screened for are treatable, such as PKU and Wilson's disease. Diseases like cystic fibrosis or Bloom syndrome need management throughout the child's lifetime. Some conditions like Canavan disease and spinal muscular atrophy have no available treatment. Over 80% of babies born with genetic diseases have no previously known family history. So, irrespective of family history, it is recommended for all couples to undergo the carrier screening test. You should definitely take the Claria test if you are married to a relative, if you have a history of multiple miscarriages, if you belong to an ethnic group with a high rate of certain genetic disorders. If the report shows that both of you are carriers, it means there's a 50% chance of your child being a carrier and a 25% chance of your child being affected. The Claria Carrier Screening Test is the only test to have been developed for the screening of genetic mutations specific to the Indian population. Claria offers a free genetic counseling service for your partner and you. Our certified genetic experts will counsel you about genetic risks and help you both understand the benefits of planning well. Just SMS Claria to 56767 or book your free appointment at www.medgenomeclaria.com. Claria, a new life well planned.